Hey everybody, welcome back to another Ask the Doctor. I'm your host, Will Cooper, and as you can see, we are at the 460 building this time as we're going to talk to Dr. Helms about thoracic surgery. And that's really important as we're getting ready for springtime to make sure you can breathe well, and he's going to tell us a little bit about lung cancer and things like that. So come on in and let's go meet our doctor. Doctor, thank you for being with us.
No, thanks for having me. Since we're both vaccinated and kind of socially distanced here, I think it's okay to take our masks off and do that.
First question I have for you today, what is thoracic surgery?
Basically, thoracic surgery is surgery of the chest. It's anything from here to here. Involves the lungs, the heart, the ribs, the space in between the ribs, or in between the lungs. There's some, the esophagus, windpipe, stuff like that.
What kind of diseases do you treat?
Primarily, we treat diseases of the lungs, so lung cancer. There's some infections that we deal with, infections in between the lung and the ribs. Other cancers of the chest, thymic cancer, esophageal cancer, fluid collections around the lung and the heart, stuff like that.
Who is at risk of getting lung cancer?
Anybody is at risk, but the people most at risk are people that have smoked, any kind of smoking, cigars, marijuana, vaping, all those things. Other risk factors include exposure to asbestos, exposures to radon, people with a family history of lung cancer.
Is there a way to screen for lung cancer?
Yes, there's a lung cancer screening program, which involves a CT scan of the chest. It's done in conjunction with both radiologists and pulmonologists, thoracic surgeons, who look over all this. And it's not just a CT scan. It involves a number of people and usually involves multiple CT scans and whatever other modalities or diagnostic tools we think we need.
What happens when someone is diagnosed with lung cancer?
Then there's a number of different treatments. It all depends basically on stage, but they involve surgery, chemotherapy, and radiation. And some people, hopefully with early stage lung cancer, can only need surgery. Some people can just have radiation, but some people require a combination of 2 or 3 of those treatments.
If you decide that a patient does need surgery, can you do it without a large incision?
All the thoracic surgeons here at Northside are experts in minimally invasive thoracic surgery, and we can do most of the surgeries with the very small incisions, either with a robot or just some specialized instruments. And so, we can usually take care of everything with small incisions.
How long do patients normally stay in the hospital after thoracic surgery?
Yeah, most people stay in the hospital between 1 to 3 days. The average is 3 days, but sometimes it's a little bit more, sometimes it's a little bit less, but 1 to 3 days.
Last question I have for you today. What is the Lung Nodule Clinic?
The Lung Nodule Clinic is a clinic that's made up of a bunch of different specialties, thoracic surgery, pulmonology, medical oncology, radiation oncology, and we all get together, we look over people's CT scans and any other diagnostic data, PET scans, biopsy results, and decide what is the best treatment for people that have any abnormalities of the chest, usually lung nodules. But it's one of the main things we have here at Cherokee that help us to get people diagnosed and treated very quickly for any, usually lung cancers, but any cancers of the chest.
All right, well, that's all the questions I have for you, Doctor. Thank you for being with us.
Thanks for having me, and if you have any other questions, please contact Northside Thoracic Surgery.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.